Welcome, everyone, to the very first episode of the Bridging Science and Soul podcast.
Mm.
Now, this will be a conversation between two brilliant doctors from very different fields and paradigms. And these doctors also happen to be father and daughter. Now, on one half of this conversation, we have the father, Dr. Stephen C. Brewer. He is a board certified medical doctor through the American Board of Family Medicine, and he spent decades in clinical practice, research, and teaching, always looking at how science and medicine can help people live healthier lives. He's currently the medical director of Canyon Ranch. On the other half of this conversation, we have Dr. Elizabeth Brewer. She is a doctor of clinical psychology, she's an integrative psychotherapist, yoga teacher, and a movement therapist. Her work brings together mind, body, and story, helping people connect with deeper dimensions of healing. Together, they represent science and soul, and they will bring this into the dialogue. And one will be from the lens of medicine, and the other will be from the lens of psychology and lived experience. And I'm your host, Zale. So, today we're going to begin with a question that may feel simple, but carries a whole lifetime within it. And that question is, what does healing mean? Of course, we cannot fully answer such a question in one conversation, but we will see what emerges from these two perspectives. And though Dr. Stephen Brewer may represent the science and Dr. Elizabeth Brewer may represent the soul, trust me, I know them both. They're both very
Oh.
scientific and they both have a lot of soul. So I'm excited for the synergy of this conversation. And in the spirit of this won't be a debate. It will be a mutual discovery, let's say.
Mm.
So before we dive in, I would love to invite each of you to tell us a bit more about you and how you were drawn to your respective fields. So we can start with you, Stephen.
I grew up with the son of a veterinarian, so medicine has always been part of my life. I think in many ways, being a son of a veterinarian, you get more experience in medicine than if my father was an MD, because you obviously kids can't follow their father in a doctor's office. But if your father is a veterinarian, you have to go out and help him hold the cows, hold the pigs, help them do all, procedures. From a very early age, I was exposed to medicine. Then my older sister decided she was going to be a nurse, and this is when I was still in high school, and she went on a training to be a nurse. And then I went to college and decided I guess I want to be a physician. I wasn't too excited about going back to the farm because there was something about going outside and walking around and trying to hold a cow. I'd rather just listen to a patient and take care of them from that perspective. Then I decided I was going to go back to a small town. So I studied medicine and did a residency in family medicine. Went back to a small town of about 2,500 people. Uh, when you're the country doctor, you kind of do everything. Couldn't charge much money because the poor farmers were not making that much money. And you did everything from setting bones to delivering babies to taking care of colds. And from birth to death, and you were usually not only birthing babies, but you had to go to nursing homes and take care of people at nursing homes for whatever their ailments were. So I saw the whole gamut of that aspect of medicine. Then eventually I decided I wanted to get my teaching gig in. And so I ended up going back and teaching for a while at my residency program. And then finally went to a suburban practice in Cincinnati, Ohio, and became a suburban doc and did practice medicine more in a suburban situation. Didn't deliver any more babies, didn't do a lot of any more fractured bones. The specialist did that. Then in the middle of my career, I decided to look outside the box a little bit and study this form of medicine called integrative medicine and studied that for about 3.5 years. And then there was an opportunity to practice that full time by becoming the medical director in Tucson at Canyon Ranch. And I've been there for the last 21 years.
Fantastic. How about you, Elizabeth?
Well, Father, it's interesting that you just shared that story because you said you can't follow your dad, who's a doctor, around. And my story begins as the daughter of a medical doctor who, as you just heard my dad's story, went back to school for integrative medicine when I was a child. And so I remember as a little kid, had to have been like 3 or 4, sitting in the same room watching VHS videos on integrative medicine and learning about traditional Chinese medicine and acupuncture, and the meridian pathways. And so, of course, I thought, well, I want to grow up and be like my dad. And I love people. I've always loved people, people's stories, learning about them and listening as well, and moving. I love moving. And so I went into the field for fun, yoga, teaching yoga, um, and fell in love with public health. So working with the health of the people, um, and furthered my understanding of the body through the yoga frame of looking at Ayurveda and the Nadi channels, which were very similar to my father, learning about the meridian pathways. They were energy pathways, ways in which energy moves through the body and the connection with healing. And so, movement therapy, of course, got me so far within the body. Um, but there still was something missing. Um, Fun facts, I also am an aquatic therapist. And so the body is also a way of, um, I would say, understanding how energy moves. Um, and so, how did I come into psychotherapy? Well, my father, I kept asking my dad, who's the doctor, if I could write a book with him because there were so many stories that um, I wanted to share in regards to healing. And my dad said, not until you're a doctor. So I got my doctorate, and here we are.
Amazing. It's so interesting how the thread of healing kind of travels through the generations from veterinarian to physician to, you know, um, clinical psychology and kind of more holistic healing types of things. And yeah, I'm really curious to see now how these differences will come out between these two generations and between these two paradigms. So we can start with you this time, Elizabeth. I want you to define healing. What is healing to you?
Well, I'll start out by saying that when I first suggested this podcast to my father, I said, let's pick a topic. And can we start with what is healing? That question. And my father said, that's too broad. And I would say that for me, that is really the heart of healing for me, not the broadness, but the multiplicity, the different perspectives that we hold, the different stories that we hold within us and around us that are conscious and unconscious. Um, and the healing for me, to answer your question, Zale, is when the body, the mind, and history and culture stop living in separate rooms and start talking to each other again. And it's also when we stop going, this is my fault, this is your fault, or this is your fault, and realize that we've inherited these stories and wounds that aren't just ours. And yes, Dad, some of mine came from you. And healing is coherence and waking up to all of that and being in dialogue with that, being in dialogue with my father.
Hmm. How about you, Steve? What is healing?
I think healing is different for every individual. Healing for a child may be um, resolving their tonsillitis by taking some medicine for a few days and their pain is gone and the inflammation goes away. Healing for somebody else may be recovering from a surgical procedure and getting back on their feet again. Healing for other people may be just being able to cope with their underlying illness, and maybe they're never going to be able to be healed or resolve that illness, but being able to come to terms with that illness and understand what they can do, what their body can do in terms of uh, improving or at least maintaining. Sometimes healing is kind of one of those things you see when people are in the process of dialing with hospice. Um, People will be at the end of their life, and maybe healing to them is passing through to the other side by in a peaceful way and having um, resolved some of those underlying issues that have gone on through your whole life. And you go, okay, there's a resolution. I've resolved whatever problems that have been in the past. So I don't think there's one sentence for healing. Every case is different. And if you give an ailment, and doctors generally deal with ills, my focus the past several years, however, has been more in terms of prevention. But if you're dealing with ails, how can you best deal with that ailment?
I see. So one interesting thing I note um, in as a difference in each of your descriptions on healing, um, Steve, you're coming more from the perspective of having an ailment and solving that ailment. Is that fair to say?
Well, in my field, generally that's what we see more than anything else. And again, there's so many different versions, but if there is an ailment, how can I um, resolve that ailment or at least come to terms with that ailment would be a source of healing.
I see. And Elizabeth, I didn't hear much about in your description ailments or problems. I heard more about kind of a harmony between different experiences one might have. You mentioned the body, but you also mentioned cultural and historical and all those things. And, that might not usually be what a medical doctor thinks about when they think about healing.
Mhm.
So I'm curious, how do you see Steve's description in terms of ailments, and how does that fit into your description of harmonizing between these multiple different things?
I love that you use the word harmony, because that was actually the first word that came to mind for me um, when you started to name what you heard. Um, and for me, psychology isn't about fixing people. Um, I'm drawn to the way that pain carries a story when the body remembers what the mind can't always say. And I feel that my own history of working with the body first as a yoga teacher and movement therapist, it really showed me that healing could be less about solving an ailment and more about waking up to ourselves. And then psychology is the language and depth that is a continuation of that thread. So I feel this pain in my chest. There's this pain, there's this feeling, there's this sensation, but instead of treating it as this is the problem, this is a signal, And then beginning to listen to what is that signal trying to tell me? How much have I been carrying? What is the story that is speaking through me that needs to be said, to be listened to and heard?
I see. What do you think about that, Steve?
Um, we all have these conversations all the time with our bodies and our minds. And, again, I say everybody, their process of healing is a very individual basis. I mean, somebody may feel that, gee, I'm no longer bleeding, so that's a healing process, versus somebody else said, gee, I want to run a marathon. Well, that's a different type of healing, right? So I think it's always about, it's not always, but it's generally about, from the eye of the perspective of the person that is quote unquote trying to be healed. So again, if you ask five different people with the same type of issues, you will probably find five different answers, unless it's something very simple about, take this piece of wood out of my leg because I've got a foreign body there. I mean, that's a healing, but most of it's always much more complicated.
Do you think people usually know the ways in which they need to be healed?
Um, I think they know how they want to be. You know, a person that has a terrible abdominal pain, they know they want to be without that pain. Or a person with migraines knows that what their focus is not having that pain anymore. That's a sense of healing. So, yeah, I think most of us know what we want. Others don't, they don't understand. They may have a particular issue and they're directing only at that issue, but it was something else that caused that issue. And you're not going to solve the immediate problem till you understand how you got to that place in the first place, and you have to resolve that. I'm trying to give you a mechanical answer. You may have a bad knee, okay? And you're limping a lot because that knee is painful. So initially but you present to a doctor, and not with the knee problem, but with a terrible back pain. And why do you have the terrible back pain? Because you've been limping all the time and you've changed your posture. And so you go into the doctor saying, you got to fix my back. Well,
Mm.
that's not going to solve your issue. The real issue is you got to figure out what's going on with the knee to fix the knee, because your back will never get better. So a lot of times more often than not, I think we do know, but many times we don't know, and that's, I think, where the practitioner, the specialist, needs to come in and kind of like, okay, even though this is what seems to be the real problem, it seems to be the problem. The real problem is over here.
I love that I love that mechanical example. Um, because it's like there's like a misplaced identification of
Mm.
where the healing needs to take place. Right. And I'm curious on your perspective on this, Elizabeth, because
Mhm.
you're also looking at not just the body, but the mind and
Mhm.
other things, right? So I'm curious if you also have that cross
Mhm.
um, misidentification. Maybe if from your perspective, could something be wrong with your body, but it's actually something else that's
Yeah.
outside of your body that needs to, be worked on. So what do you think?
Mhm. Well, the question you asked earlier, do people know how to heal?
Hmm.
It's a great one. No, the knowing is important, because I would say yes, but it's complicated. And I feel people actually do know how to heal, at least on some deep instinctual level. And the body already leans toward balance, toward your word earlier, harmony. But often we've learned to override those signals, to dismiss emotions, to push past the pain, or to carry the blame. And so what I think about therapy from a therapy perspective, psychotherapy perspective, I want to create a space where those innate healing capacities can surface. So less about me giving someone, oh, here, this is what you should do. Here's the map. It's about helping them remember that they already carry it. So trauma, capital T trauma, little t trauma, culture and history can obscure that wisdom because we are taught, shouldn't say we are taught, let me be more specific. In today's modern society, within a number of cultures, many that we are swimming in and may not be aware of it, is one in which we ignore our bodies, we carry silence. And then that knowing gets buried, if that makes sense.
Yeah, that makes sense. That makes sense. Um, I'm curious, Steve, if you have encountered any of this in your practice in which someone's ailment, let's say, is like it requires some kind of not simply a physical fix, but some kind of, I'm going to use Elizabeth's word of remembering or something like that. So I'm asking you to also step outside of step more into Elizabeth's world, and view healing from her perspective. And I'm curious if you've encountered any situations in your practice and your patients where that perspective kind of came more to the forefront.
So I'm stepping over into my daughter's world here a little bit.
Yeah.
Let me give you an example. So patients will present to me with a particular complaint. More often than not, it's pain or some kind of discomfort. When I first learned about this, the piece of the mind and body was when I was a resident. And when you're a resident, you in the old days they made very little money, and had to buy food and had to have a house, have a roof over your head. So as soon as you had 1 year of a residency training under your belt, you could apply for a state license, and you could actually go out and practice medicine at that point. So most docs, most residents then would go off a few times during the week, work all night in an emergency room at some little hospital within about an hour or so of that, and and that's why I'm making some extra change. Okay, so you would go. So the one I went to is this little hospital in Ohio. It's about 50 minutes from my residency program. I'd go there, get there about 6 o'clock at night, and be responsible for the emergency room because in those days we didn't have emergency room docs. They would just get residents and have them kind of control the emergency room. And so this one was usually pretty quiet, and so I knew I was going to get a little bit of shut eye. And I was laying down for about an hour, and almost get a call uh, into my little quarters, and they said, "You've got to come down here right away. There's this young woman that's crying, and she's just got the worst rash we've ever seen." So I go down there and I see her, and she's crying and scratching, and she's got the worst hives I've seen. I don't know if I've ever seen the hives that bad, and she's scratching all over her. And I said, "Are you on some new medication?" She said, "No." I said, did you take some berries or nuts? Have you ever had a reaction before? No. I said, "Is there anything happening in your life?" She goes, "I'm getting married tomorrow." And it's the emotion of, what's happening, this stressful event in her life has has presented itself with this terrible physical finding of the hives. And so, if you're talking about the mind affecting our body, that was about one of the most clearest things I've ever seen. And then from then on, I would see so many patients that things didn't make sense. I've got more abdominal discomfort than I've had before. I'm having more migraines than I've ever had before. And instead of just writing more prescriptions, many times I'll try to find out, is there something new that's happening in your life that's causing extra stress? And I cannot tell you how many times they'll go, well, nobody's asked me that before. And I say, I know, I'm asking you. And they'll tell you so many times. One lady I just saw recently, she lost her husband and lost her dog of 16 years. Okay. And now suddenly she's got the worst abdominal discomfort she's ever had. And also she's breaking out in a rash. Um, I can give her the salve for her arms. I can give her something to maybe settle down her stomach, but that's not the answer. The answer is addressing the stressors that are in her life. And I send them to somebody like my daughter to help them deal with the stress and the depression or whatever they're dealing with, because they're never going to get better until they deal with those issues.
Fascinating. What do you think about that, Elizabeth? Does that make sense to you?
Well, it's interesting because I almost shared that story when we were giving our introductions.
Hmm.
Um, because that is a story that I remember as a little kid attending. I believe it was at Tri Health. What was it, Dad? Health, was it Tri Health?
I can't remember.
You were the medical director there in Cincinnati,
Oh,
Ohio.
I thought you were talking about some conference I was
No,
at.
this is Tri Health. Was it a Tri Health
That's
Health
where
Center, Wellness Center?
I was the director of integrative medicine there. Yes.
There you go. So I was a kid because I remember I had just come back from school or skating, and I was in the back of your lecture. And I believe I was trying to eat and do homework, but I remember you telling me that story because I was supposed to be hiding in the back, but I kind of peeked my head out and went, oh, that's interesting. There's story behind the ailment. Um, and so I would say, yes, the ailments, maybe it's about finding, I resist when I hear ailments. Oh, this is a problem. And so then I resist and then I move away from it versus Dale, you've helped me connect here, is that the ailment, it's a word, but it also means a storyteller for me in my language because the body will speak through pain, through tension, through fatigue, through rashes when something deeper needs that attention. And I always tell all of my clients, if there is, physical ailment, have you spoken with your doctor? Can we rule out any medical concerns or issues? Because the treatments are vital. But I'm grateful to hear my dad, not reducing the ailment to just a problem to fix. And often what shows up in the body, carries this, as my dad described, untold story, of what's happening in one's life, either present. My dad has many stories of working with patients for over 40 years, and so I've heard quite a few. Um, Now I want to share a story about my dad, but for the sake of time, I won't. Maybe in a future uh, episode, we'll be able to bring it in. Um, but how physical symptoms can show up at a particular time each year.
Hmm.
Um, could also be cultural expectations, intersectional identities that haven't had a voice and haven't had a voice yet. So when we listen at that level, then healing isn't just about the relief, it's about coherence.
Hmm. I don't know if we have enough time, but would really love to dive into kind of the difference between the coherence you're talking about and the fixing of a problem or fixing of an ailment. Because I think you might have some different perspectives there. Um, but what do you think? Maybe we leave that for next episode?
Yeah.
Yeah. Okay.
Oh,
Fantastic.
there's a hook.
Yeah, yeah. So just to wrap up this one, I'd love if you guys could give just a short snippet of a summary of what your definition of healing is, and also what the other person's definition of healing is. So yeah, let's start with Steve on that one.
I'm going to make this real simple. It's just, I think healing is in the eye of the beholder, and it's not, it's the patient, and it's also the practitioner. They both have a little bit different perspective of what they think is healing. And the most important one, of course, is the patient. The practitioner can think, well, I want to do this or do that, but if the patient feels they're in a better space, they're healing, that's the most important thing. So I think healing is truly the recipient is the most important person there.
I'd also love for you to give what you think Elizabeth's definition of healing is.
I'm excited about this. Thank you.
Oh, you want to ask me what I think
Yeah.
her definition is?
Yes.
Yeah.
Yes.
Well, I think
Thank you.
I'm sure she'll disagree, but anyway, I think her definition of healing is helping you deal with potentially unresolved issues in life, whether it's trauma, whether it's just events in your life or relationships, and being able to maybe not be able to. I don't know if you mean the word resolve, but at least get you in a better space and help you understand the situation, and sometimes understanding of how you've gotten where you are is part of the healing process.
Thank you. Elizabeth, what is your definition of healing and what's Steve's definition of healing?
So I'll start with um, my definition of healing, and I'm actually going to use your word from earlier, Zale, harmony, inner harmony, outer harmony, when um, the body, the mind, story, history, culture, intersectional identities stop living in separate rooms and start to connect again. Um, and moving into my dad's world and his definition, I heard him say, and I'm not going to do the psychology speech of saying it's in the eye of the beholder. It is that, and what I'm also hearing is that ultimately healing is when we feel better, when we feel better. Um, when a treatment is given and then the body returns to functioning um, as it can, or as my dad would say, as it should. Um, but I like to say, don't shit all over yourself, which I shouldn't add, but I'm shitting all over myself right now.
Well, this was a great bridging of science and soul, I'd say. What do you guys think? Yeah. All
Yeah.
right. Amazing. Well, thank you everyone for listening. Definitely stay tuned for the next episode where we'll get deeper into this.
Hmm. Thank you, Zale.
Thank you.
Thanks, Dad.